Every week, I meet someone who says the same thing. If only I'd come in sooner. Maybe it was a lump they ignored, a cough that wouldn't go away, or weight loss they thought was stress. By the time they were diagnosed, it was already advanced. But here's what most people don't realize. Cancer gives us warning signs. And today, I'm going to show you 10 ways to check yourself right now for clues your body might already be giving you. I'm a consultant physician with over 15 years of experience working in hospital medicine, and this might be the most important video you watch this year. Let's start with number 1. Feel for lumps in your neck, armpits, or groin. Use the pads of your fingers. Gently feel along both sides of your neck, under your jaw, behind your ears, and into the hollows above your collarbones. Then check under your arms and in your groin. What you're feeling for are firm, painless lumps that don't move easily under the skin. Lymph nodes can swell with infections. That's normal. But if they stay for more than 3 weeks, especially without a cold or fever, it could be a warning sign. One of my patients noticed a lump in his neck while shaving. He waited 6 months. When he finally came in, it was stage 3 lymphoma. Had he acted sooner, treatment would have been simpler and faster. Number 2, do a breast self-exam, and yes, that includes men. Breast cancer in men is rare, but it does happen. Once a month, ideally after your period if you have one, stand in front of a mirror. Raise your arms and look for any changes, shape, dimpling, swelling, or changes in the nipples. Then, using the flat part of your fingers, gently feel across your entire chest in circular motions, including under the armpits. What to look for: hard or irregular lumps, skin that looks puckered, or discharge from the nipple. A patient of mine, just 31 years old, found a tiny lump while showering. She came in that same week. It was early breast cancer, and because she acted quickly, she's doing great. Number 3, check your testicles if you have them. The best time is during a warm shower when the skin is relaxed. Gently roll each testicle between your fingers. Feel for any lump, change in size, or heaviness. Testicular cancer is the most common cancer in men under 40, but it's also highly treatable when caught early. A man I saw recently thought his lump was just from lifting weights. It wasn't, but because he checked, we caught it in time. Number 4, notice if your clothes are getting looser, even though you're not trying to lose weight. Weight loss might seem like a good thing, but if it's unintentional, even a few kilos, it could be a subtle sign, especially if it's combined with tiredness, appetite loss, or changes in your gut. Cancers like pancreatic, stomach, lung, and blood cancers can burn calories in the background. And even if you don't have a set of scales, simply try on some old clothes and see if they are very loose. Ask yourself, did I try to lose weight? If not, and it's still happening, speak up. Number 5, listen to your cough. If it's lasted more than 3 weeks, take it seriously, especially if it's dry, worsening, worse at night, comes with hoarseness, or you see blood. I once saw a healthy man in his 50s who came in for a lingering cough. He'd never smoked. A scan showed a small tumor in his lung. We removed it completely, no chemo needed. Why? Because he acted early. Number 6, are you waking up drenched in sweat? Not just warm, I'm talking sheets soaked, clothes wet, needing to change the bedding. If that's happening regularly and there's no fever, no infection, and no hormonal cause, you need to be checked. Lymphoma and some blood cancers can cause intense night sweats, especially if you also feel tired or are losing weight. If your body is whispering at night, listen. Number 7, check your skin. Use a mirror or ask someone you trust to look at your back, legs, scalp, and other hard-to-see areas. Apply the ABCDE rule to any moles. A is for asymmetry, B is for border. Is it irregular? C is for color. Are there multiple shades? D is diameter. Is it bigger than 6 millimeters? E is evolving. Is it changing over time? One teenager I met had a mole that had been changing slowly over the year. His mum insisted he get it checked. It was melanoma, and we caught it just in time. Number 8, watch your poop. I know, not the most glamorous tip, but it's crucial. Look for blood in the stool, long-term constipation or diarrhea, a sudden change in your normal bowel habit, or a feeling that you haven't fully emptied. These can all be signs of bowel cancer, especially after age 40. A teacher I met had seen blood on and off for a year but assumed it was just piles. By the time we checked, it was a large tumor. Please, don't wait. Number 9. Look in the toilet after you pee. Before you flush, check the color. If it's pink, rusty, or reddish, even once, it's not normal. It could mean blood in the urine, which can be a sign of bladder, kidney, or prostate cancer. One man thought it was from beetroot. It wasn't. If you ever see it, get checked. Number 10. Are you having trouble swallowing? Is food getting stuck? Or do you have persistent indigestion or reflux that doesn't respond to antacids? Esophageal and stomach cancers can cause these symptoms, often quietly, especially if you're over 40. If your digestion has changed and it isn't going away, don't brush it off. So what if you spot one of these signs? First, don't panic. Most of the time it's not cancer, but if it's new, persistent, or worsening, get it checked. Don't wait to be sure, that's our job. Let's now go through some common questions I get asked, and please, if you've made it this far, don't forget to subscribe for more health-related content like this. Question 1. If I have one of these symptoms, does it mean I have cancer? Most of the time it doesn't. But that's not a reason to ignore it. These are signs to check, not signs to fear. Your body is communicating with you. Don't ignore it. Question 2. How long should I wait before seeing a doctor? If it's been more than 2 or 3 weeks, book an appointment. Don't wait for it to get worse or for it to feel serious. If something doesn't feel right, act. Question 3. What kind of tests will I need? That depends on the symptom. It might be blood tests, a scan, or just a physical exam. Sometimes it's simple. Sometimes we need more. But remember, most tests rule cancer out, not in. That's the point. Question 4. I'm young and healthy. Should I still be checking? Yes, absolutely. Cancer can affect young people too. Testicular cancer, melanoma, lymphoma. They don't wait for your 50th birthday. Knowing you're normal helps you catch the abnormal. Question 5. Could stress or anxiety cause these symptoms instead? They can, and often do. But don't assume. If your symptoms are physical and persistent, they deserve proper attention. Mental and physical health are connected, but we should never blame one without checking the other. Question 6. What if I'm too embarrassed to talk about these things? You're not alone. But remember, doctors see this every day. There is nothing embarrassing about taking your health seriously. We're here to help, not judge. Question 7. Can I just monitor the symptom at home for a while? You can, but make sure there's a plan. If it's been going on for weeks already, don't delay. Waiting without a time limit is the trap. Question 8. Should I be getting regular cancer screening? That depends on your age, gender, and family history. There are national screening programs for bowel, cervical, and breast cancer. Ask your doctor if you qualify. It's one of the best ways to catch cancer early. Question 9. Can I reduce my cancer risk? Yes, there's so much you can do. Eat well, don't smoke, limit alcohol, move your body, protect your skin. It's not about being perfect. It's about stacking the odds in your favor. Question 10. What should I say to my doctor? Just be honest. Say what you've noticed, when it started, and how it's changed. You don't need fancy terms. Something as simple as, I saw a video and this made me think, is more than enough. Your job is to speak up. Ours is to listen. You made it to the end, and that already puts you ahead. This video wasn't made to scare you, it was made to empower you. So do your checks. Talk to your doctor. Share this with someone you care about. I'm Dr. KDM. Stay healthy, stay aware, and subscribe.